Hi guys, Dr. Maune again. So we're going to be working on our second part of this series where we were talking about filling in spaces throughout your arts in places where you've lost a tooth. One of the things I wanted to talk about, just get more in depth are the removable partials that we touched on earlier. Okay. Now, there's multiple ways that you can use the multiple materials that these are made out of. Now, depending on the type of materials that they are, it definitely dictates the longevity of the prosthesis. That way, it depends on if you're going to be able to eat with it in, as well as the amount of time that it'll stay inside your mouth without breaking down. Okay. Now, we talked about before, this is more like what's called an interim partial teacher. Now, on an interim, everything around the outside of it's all plastic. So the good thing about this is if you got a tooth extracted or multiple teeth extracted, and we're going to be using this to be able to replace it, what we can do is trim everything back. As your bone starts changing underneath it, we can make sure that it stays nice and comfortable inside your mouth, that you can eat with it and everything else. Okay. And then after that, even sometimes we still have to do what's called a soft reline on the inside of it, because all of your bone, as it shrinks down away from this, you'll end up with a gap. You get food stuck underneath it, you won't like it, so we'll do a soft liner on the inside of it, and then that'll then fill in the gap so everything fits up nice up against your tissue, so you don't get food stuck underneath there anymore. And then after everything changes completely, then we would move away from this temporary partial and move over into something more permanent. Now, this is a cast metal partial. It looks kind of wicked, I know, but whenever you look at it, it has a lot of different functions. So this cast metal partial does have some clasps on it. Now this person that this was made for is missing some teeth closer to the front. So when you use a cast metal partial, one of the things about it is you may have one of these clasps that'll come down that you would be able to see if you smile. Usually it's very, very small. And there's lots of people walking around that do have clasps just like this that retain in their mouth. They wear them all day long. It doesn't fall down. It doesn't get food stuck underneath it or anything else. And they have no issues with it. But most of the time we do everything we can do to get clasps in the back because it is metal and a lot of people don't want to show that whenever they're smiling. This is a great long-term prosthesis that you can actually use for your mouth. It's extremely stable, it's very durable, so you'll be able to use it for a long time whenever you get it put in there. Another option would be a flexible based partial. Now those are a lot more aesthetic because, like this, they don't have these metal clasps that go on it. They're actually gum-colored clasps and they're a lot thinner. A lot of the times with those, you still have to put them in warm water every day before you put it inside of your mouth because it's flexible. So you want to get the material, get it to where it's a little more pliable. A lot of the times if you put it in at room temperature and try to put it in your mouth, it may rub really hard, it may hurt, but if you get it warm before you put it in, then it'll end up fitting and adapting to your teeth a lot better. So then longevity-wise, no matter what you do, if you do a cast metal partial, a flexible partial, or anything like that, it's going to be suited to be able to be used for a long time, a lot more so than a partial like this. Like I said, these are really just temporary things. So it'll get you by, and it'll get you through and get you used to using one. Once you get to move away from your temporary over to your final, you're going to be a lot happier with it. It's a lot thinner, it'll fit a lot better inside your mouth, and you're going to enjoy it. So it tackles a lot of birds with one stone. It allows you to function, and at the same time replaces a lot of teeth. And usually everybody gets along perfectly great with it.